How bad breath could signal a bigger health issue. Last month, a woman came into my office convinced she just needed a stronger mouthwash. What we discovered probably saved her life. And if you've been dealing with bad breath that just won't go away, no matter what you try, this conversation might be the most important 20 minutes you spend today. I'm Dr. Ethan Miles. I've been a dentist and health specialist for over 25 years, and I've seen thousands of patients walk through my door thinking their mouth problem was just about their mouth. But here's what most people don't realize. Your breath can be a window into your entire body's health. And for those of us over 55, that window becomes even more important. Today, I want to talk to you about something that affects nearly half of all adults, but almost nobody wants to discuss openly. Bad breath. Halitosis. That persistent odor that makes you cover your mouth when you talk, that makes you worry about getting close to your grandchildren, that keeps you reaching for mints throughout the day. But we're not just going to talk about the embarrassment. We're going to talk about what that breath is actually telling you. Because sometimes bad breath isn't just about what you ate for lunch. Sometimes it's your body's way of waving a red flag, trying to get your attention about something much more serious happening inside. So let me ask you this. Have you noticed that your breath doesn't smell quite right, even right after you brush? Do people step back slightly when you're talking? Have you found yourself becoming more isolated, avoiding close conversations because you're worried about your breath? If you're nodding yes to any of these, I want you to know two things. First, you're not alone. And second, there's a reason this is happening. And understanding that reason might just change your life. Let me tell you about Margaret. She's 72. A retired teacher, someone who always took pride in her appearance and her health. She came to see me because her daughter had gently mentioned that Mom's breath had changed. Margaret was mortified. She'd been brushing 3 times a day, using mouthwash, chewing gum constantly. Nothing helped. When I examined her, yes, we found some gum issues. But more importantly, when I asked about her overall health, she mentioned she'd been feeling more tired lately, a bit dizzy sometimes, and her mouth was always dry. Within 15 minutes of our conversation, I knew we needed to look beyond her teeth. We ran some tests, and it turned out Margaret was in the early stages of diabetes. Her bad breath wasn't a dental problem at all. It was her body's warning system. 3 months later, after working with her doctor to manage her blood sugar, Margaret's breath was completely normal. But more than that, we'd caught a serious condition early before it could cause real damage to her heart, her kidneys, or her eyes. That's why I'm here today, because your breath isn't just about social embarrassment, it's a diagnostic tool. And I want to teach you how to read what your body is telling you. Now, before we dive deeper, I need you to understand something fundamental. Your mouth is not a separate entity from the rest of your body. I know that sounds obvious, but we tend to think of dental health as somehow different from medical health. We go to the dentist for teeth problems and the doctor for body problems. But your mouth is connected to everything. The blood vessels in your gums lead directly to your heart. The bacteria in your mouth can travel to your lungs. The dryness of your tongue reflects your hydration and your medication effects. So when we talk about bad breath, we're really talking about a symptom. And symptoms always have causes. Sometimes those causes are simple and local, right there in your mouth. But sometimes, especially as we get older, those causes are systemic. They're about your whole body trying to communicate with you. Let me break this down into the different types of bad breath, because not all bad breath is the same, and understanding which type you have is the first step to solving it. The first type is what I call morning breath. This is normal. This happens to everyone. When you sleep, your mouth produces less saliva. Bacteria that normally get washed away start to multiply. They break down tiny food particles and dead cells, producing sulfur compounds that smell unpleasant. When you wake up and brush your teeth, drink some water, and get your saliva flowing again, that smell goes away. This is not the bad breath we're worried about today. The second type is food-related breath. Garlic, onions, certain spices, coffee, alcohol. These contain compounds that get absorbed into your bloodstream, travel to your lungs, and come out when you exhale. This is why brushing doesn't always help immediately after eating these foods. You're literally breathing out the compounds from inside your body. Again, this is temporary and normal. The third type is what I call dental bad breath. This is caused by problems right there in your mouth: gum disease, tooth decay, infections, poorly fitting dentures, dry mouth from medications. This type of bad breath is persistent. It doesn't go away after brushing. It's there most of the day. And it often has a specific quality to it, a sort of rotten or musty smell. But here's where it gets really important. The fourth type is systemic bad breath. This is when the odor is coming from somewhere else in your body and your mouth is just the exit point. This is the type that can signal serious health issues. And this is the type I want to focus on today, because this is the type that could save your life if you recognize it. Let me give you some examples of what I mean. Have you ever noticed that some bad breath smells sweet, almost fruity? That's not usually a dental issue. That sweet smell can be a sign of uncontrolled diabetes. When your body can't process sugar properly, it starts breaking down fat for energy instead. This produces chemicals called ketones, and these ketones have that distinctive sweet smell. If your breath smells like fruit or nail polish remover, and especially if you're also feeling thirsty all the time, urinating frequently, or feeling unusually tired, you need to see your doctor right away. This could be diabetic ketoacidosis, and it's a medical emergency. Or let's talk about breath that smells like ammonia or urine. Sharp, chemical, unpleasant. This can be a sign that your kidneys aren't filtering waste products properly. Your kidneys are supposed to remove urea from your blood. If they're not working well, that urea builds up and can be released through your breath. This is especially important to pay attention to if you have high blood pressure, diabetes, or a family history of kidney disease. What about a sour smell, like stomach acid? This often indicates acid reflux or GERD. When stomach acid regularly comes up into your esophagus and mouth, it creates a distinctive sour odor. Many people over 55 deal with this, often without even realizing they have reflux. They might just feel a bit of heartburn now and then, or have a persistent cough, or feel like they need to clear their throat a lot, but that acid is damaging their tooth enamel and creating chronic bad breath. And here's one that concerns me greatly: breath that smells fecal, like something rotting. This can indicate a bowel obstruction or severe constipation. It can also, in rare cases, be a sign of certain types of cancer in the digestive system. I don't say this to scare you. I say this because early detection of these conditions makes all the difference in treatment outcomes. Now, I see some of you might be feeling anxious right now, wondering if your bad breath means something terrible. So let me be very clear. Most bad breath is not a sign of serious disease. Most of the time, it's a dental issue that can be fixed relatively easily. But the point is, you need to know the difference. You need to know when to be concerned and when to take action. Let me tell you about Robert. He's 68, came in for a routine cleaning. His hygienist mentioned to me that his breath had an unusual smell, sort of musty and fishy. She said it wasn't the typical gum disease smell. When I examined Robert, his teeth and gums actually looked pretty good. But I asked him, "How's your overall health?" He said, "Fine, no problems." But then I asked more specific questions. Any trouble breathing? Well, he said, "Now that you mention it, I do get winded more easily lately." Any cough? "Yeah, a little one in the morning." "Do you have any history of lung issues?" He paused. He'd smoked for 30 years but quit 10 years ago. I sent Robert to his doctor for a chest scan. They found early stage lung disease. Not cancer, thankfully, but significant chronic bronchitis that needed treatment. The bacteria in his lungs were creating that unusual smell on his breath. Without treatment, this could have progressed to much more serious respiratory failure. Robert later told me that conversation probably added years to his life. And it all started because someone paid attention to how his breath smelled. So how do you know if your bad breath is serious? Let me give you some guidelines, some red flags that should send you to a healthcare provider. First red flag: the smell doesn't improve with good oral hygiene. If you're brushing twice a day, flossing, using mouthwash, staying hydrated, and your breath still smells bad within an hour or two, that's concerning. That suggests the source isn't in your mouth. Second red flag: the smell has a distinctive chemical sweet, ammonia, or fecal quality. These specific smells often indicate systemic issues. Third red flag: the bad breath is accompanied by other symptoms. Fatigue, weight loss, fever, persistent cough, difficulty swallowing, chronic heartburn, excessive thirst, changes in urination, or any other ongoing health changes. Your body rarely gives you just one warning sign. Bad breath might be the first thing you notice, but if you pay attention, there are usually other clues. Fourth red flag. The bad breath came on suddenly or changed suddenly. If you've always had mild bad breath and suddenly it's much worse or smells different, something has changed in your body. That change needs to be investigated. Fifth red flag, you have existing health conditions. If you have diabetes, kidney disease, liver disease, respiratory problems, or gastrointestinal issues, and you develop new bad breath, this could indicate your condition is worsening or not well controlled. Now, let's talk about the most common cause of persistent bad breath in adults over 55. And this is firmly in my territory as a dentist. Gum disease. Periodontal disease. This affects nearly 70% of adults over 65 to some degree. And it's not just about bad breath. This is crucial to understand. Your gums are the foundation for your teeth. When bacteria accumulate along the gum line, they cause inflammation. Your body's immune system responds, and this chronic inflammation destroys the tissue and bone that hold your teeth in place. This creates pockets between your gums and teeth. These pockets become filled with more bacteria, food, debris, and dead tissue. And all of this creates a smell, a very distinctive smell. But here's what makes this so important beyond the smell. That chronic inflammation in your gums doesn't stay in your mouth. The inflammatory chemicals and bacteria enter your bloodstream. Studies have shown clear connections between gum disease and heart disease, stroke, diabetes complications, respiratory infections, and even Alzheimer's disease. Let me say that again, because this is not widely understood. The bacteria from your gums can travel through your bloodstream to your heart, increasing your risk of heart attack and stroke. The inflammation from gum disease makes it harder to control blood sugar if you have diabetes. Bacteria from your mouth can be breathed into your lungs, causing pneumonia, especially in older adults. So when we treat gum disease, we're not just fixing bad breath, we're potentially preventing heart attacks, strokes, and serious infections. This is why I tell all my patients over 55 that their dental care is part of their medical care. It's not optional, it's essential. How do you know if you have gum disease? Here are the signs. Your gums bleed when you brush or floss. Your gums are red, swollen, or tender. Your gums are pulling away from your teeth, making your teeth look longer. You have persistent bad breath or a bad taste in your mouth. Your teeth feel loose or are shifting position. You have pus between your teeth and gums. If you have any of these signs, you need to see a dentist. Not next month, soon, because gum disease is progressive. It doesn't get better on its own, it only gets worse. And the earlier we catch it, the easier it is to treat and reverse. Now, I want to talk about something that affects almost every person over 55 who walks into my office. Dry mouth. Xerostomia is the medical term. And this is a huge cause of bad breath that often gets overlooked. Saliva is your mouth's natural defense system. It washes away food particles, it neutralizes acids, it contains enzymes that start digestion, and it has antibacterial properties that keep bacterial populations in check. When you don't have enough saliva, all of these protective functions fail. Bacteria multiply rapidly, food sticks to your teeth and tongue, acids damage your enamel, and the result is cavities, gum disease, and very bad breath. Why do older adults have dry mouth? The most common reason is medications. If you take multiple medications, and most adults over 65 take at least 4 prescription medications, the chances are very high that at least one of them causes dry mouth as a side effect. Blood pressure medications, antidepressants, antihistamines, pain medications, drugs for overactive bladder, medications for anxiety, the list goes on and on. Other causes include diabetes, which we already talked about, autoimmune conditions like Sjogren's syndrome, cancer treatments, especially radiation to the head and neck, simply breathing through your mouth, which many people do at night, especially if they have sleep apnea or sinus issues. And natural aging does reduce saliva production somewhat, though not as much as medications do. Here's what I tell my patients about dry mouth. First, talk to your doctor about your medications. Sometimes doses can be adjusted, or alternative medications with fewer side effects can be tried. Don't just accept dry mouth as inevitable. Second, stay hydrated. Sip water throughout the day. Not soda, not coffee, not juice, water. Keep a water bottle with you. Take small sips frequently rather than big gulps occasionally. Your mouth needs that constant moisture. Third, stimulate saliva production. Sugar-free gum or sugar-free hard candies can help, especially ones with xylitol, which also helps fight cavity-causing bacteria. Eating crunchy fruits and vegetables like apples, carrots, and celery increases saliva flow. Even just moving your jaw and tongue deliberately can help. Fourth, avoid things that make dry mouth worse. Alcohol, including alcohol-based mouthwashes. Tobacco, caffeine, salty or spicy foods that might irritate already dry tissues. Fifth, consider saliva substitutes. There are over-the-counter products, sprays, gels, and lozenges that can provide temporary relief. Some people find these very helpful, especially at night. And sixth, use a humidifier in your bedroom at night. This keeps the air moist and prevents your mouth from drying out while you sleep. I had a patient, Dorothy, 79 years old, who came in convinced she needed all her teeth pulled. Her breath was terrible, her mouth hurt all the time, she was getting constant cavities. She was so embarrassed and frustrated. When I reviewed her medications, she was taking 7 different prescriptions, and 5 of them listed dry mouth as a side effect. Her mouth was producing almost no saliva at all. We worked with her doctor to adjust a couple of her medications. We started her on a strict hydration schedule and gave her saliva-stimulating products. Within 6 weeks, her saliva production had improved dramatically. Within 3 months, her bad breath was gone, her mouth pain was gone, and she stopped getting new cavities. She kept her teeth, all because we addressed the underlying dry mouth. Now, let's talk about dentures, because this is relevant for many people watching this. If you wear full or partial dentures, you know they require special care, and improper denture care is a significant cause of bad breath. Dentures are porous. They absorb bacteria, food particles, saliva, and stains. If you don't clean them properly every single day, bacteria colonize the surface and multiply. These bacteria produce very foul odors. Plus, poorly fitting dentures create spaces where food gets trapped. They can irritate your gums, causing inflammation and sometimes infection. All of this creates bad breath. Here's what you need to do. Remove your dentures every night. Your gum tissue needs to breathe and recover. Brush your dentures every day with a denture brush and denture cleaner. Don't use regular toothpaste, as it's too abrasive and will scratch the denture surface, making it even easier for bacteria to stick. Soak your dentures overnight in a denture cleaning solution. Rinse them thoroughly before putting them back in your mouth, and brush your gums, tongue, and any remaining natural teeth gently every morning and night. Also, and this is important, see your dentist regularly to check the fit of your dentures. As you age, your jawbone changes shape. Dentures that fit perfectly 5 years ago might not fit well now. Poorly fitting dentures don't just cause bad breath. They cause pain, difficulty eating, and can lead to serious sores and infections. I've seen patients whose dentures were so loose they were barely functional, yet they'd been wearing them that way for years, thinking it was normal. When we made new dentures that fit properly, they told me it was life-changing. They could eat foods they'd been avoiding for years. They stopped getting mouth sores. And yes, their breath improved dramatically. Let me shift gears now and talk about diet, because what you eat has a direct impact on your breath, but not always in the ways you might think. Obviously, certain foods cause temporary bad breath. We all know about garlic and onions, but for people over 55, there are other dietary factors that matter more for long-term breath quality. First, protein. As we age, we often need more protein to maintain muscle mass and strength. But when your body breaks down protein, especially if you're on a high-protein diet, it produces ammonia as a waste product. Usually, your liver and kidneys process this efficiently. But if you're eating a lot of protein, or if your kidney function isn't optimal, which becomes more common with age, you can get a buildup that comes out in your breath, creating that ammonia smell we talked about earlier. Second, sugar and refined carbohydrates. The bacteria in your mouth love sugar. They feed on it and produce acid and sulfur compounds. If your diet is high in sugary foods, sweets, pastries, white bread, you're literally feeding the bacteria that cause bad breath and tooth decay. This is especially problematic if you also have dry mouth, because you don't have the saliva to wash away the sugar and neutralize the acid. Third, fiber. If you're not eating enough fiber, you're more likely to be constipated. Constipation means waste products sit in your digestive system longer, producing gases and toxins that can affect your breath. A diet rich in fruits, vegetables, and whole grains keeps things moving and reduces this problem. Fourth, water intake. I mentioned this before, but it's worth repeating. Chronic mild dehydration is extremely common in older adults. Sometimes it's because we don't feel thirsty as readily. Sometimes it's because we deliberately drink less to avoid frequent trips to the bathroom. But dehydration reduces saliva production and concentrates waste products in your body, both of which worsen breath. I had a patient, George, who was convinced his bad breath was from some mysterious disease. He'd been to multiple doctors, everything checked out fine. When I sat down with him and really went through his daily routine, I discovered he was drinking maybe 2 glasses of water a day and about 6 cups of coffee. He was chronically dehydrated, his mouth was dry, his breath smelled stale and acidic. We didn't change anything else. We just focused on getting him to drink more water. Within 2 weeks, he came back and said, "Doc, I can't believe it. My breath is normal, just water." Sometimes the simplest solutions are the right ones. Now, I want to address something that many people don't realize is connected to bad breath: sleep, or more specifically, sleep-disordered breathing. Conditions like sleep apnea and chronic snoring. When you have sleep apnea, you stop breathing repeatedly throughout the night. Your body responds by opening your mouth to gasp for air. You end up mouth breathing all night long. This dries out your mouth completely. All that protective saliva evaporates. Bacteria multiply like crazy. You wake up with terrible breath and a dry, sticky mouth. Plus, sleep apnea causes oxygen levels in your blood to drop repeatedly. This stresses your whole system and can affect your organs, including your liver and kidneys, which we know can cause breath changes. If you snore loudly, wake up gasping, feel tired all day despite sleeping, or your partner tells you that you stop breathing at night, you need to get evaluated for sleep apnea. Not just because of bad breath, but because untreated sleep apnea significantly increases your risk of heart attack, stroke, and sudden death. It's serious. And here's the good news. Treating sleep apnea with a CPAP machine or an oral appliance that keeps your airway open not only helps your breath, but can dramatically improve your overall health and quality of life. Patients tell me they feel 20 years younger once their sleep apnea is treated. Let me talk about something else that's common in older adults and affects breath: sinus issues. Chronic sinusitis, postnasal drip, and sinus infections. Your sinuses are air-filled spaces in your skull. When they get infected or chronically inflamed, they produce thick mucus. This mucus drips down the back of your throat, a process called postnasal drip. That mucus contains bacteria and cellular debris. It coats your throat and the back of your tongue, and it smells bad. People with chronic sinus issues often have bad breath despite good oral hygiene because the source is coming from above their mouth, not from their mouth itself. They might also have a persistent cough, frequent throat clearing, a feeling of something stuck in their throat, or a bad taste in their mouth. If you have these symptoms, see your doctor. Chronic sinusitis can often be treated with nasal rinses, steroid sprays, or sometimes antibiotics if there's an infection. Getting your sinuses healthy will improve your breath and your overall comfort. Now, I want to circle back to something I mentioned earlier about systemic diseases, and I want to be more specific about a few conditions that are particularly important for people in their 50s, 60s, 70s, and beyond. Liver disease. Your liver is responsible for filtering toxins from your blood. When your liver isn't functioning properly, these toxins build up. One of them is a compound called mercaptan, which has a musty, sweet smell, sometimes described as smelling like rotten eggs or fish. If someone has significant liver disease, their breath can take on this distinctive odor, sometimes called fetor hepaticus. Liver disease can develop gradually from years of alcohol use, from hepatitis infections, from fatty liver disease related to obesity and diabetes, or from other causes. Many people don't realize their liver is in trouble until it's quite advanced because the liver doesn't hurt when it's damaged. But changes in breath can be an early warning sign. Lung infections and lung disease, pneumonia, bronchitis, tuberculosis, lung abscesses, even lung cancer can all cause bad breath. The bacteria or diseased tissue in the lungs produce volatile compounds that come out when you exhale. If you have a persistent cough, shortness of breath, chest pain, or fever, along with bad breath, you need to see a doctor immediately. Certain cancers. I mentioned this briefly, but I want to be clear. Cancers of the mouth, throat, esophagus, stomach, and lungs can all cause bad breath, either from the tumor itself or from associated infections. This doesn't mean bad breath equals cancer. Most bad breath is not cancer. But if you have bad breath, that doesn't resolve, especially with other concerning symptoms like unexplained weight loss, difficulty swallowing, persistent pain, or lumps, you must get evaluated. I share this not to frighten you, but to empower you. Your body talks to you. Symptoms are communication. When you pay attention and take action, you give yourself the best chance of catching problems early when they're most treatable. Let me tell you about the woman I mentioned at the very beginning, the one who came in thinking she needed stronger mouthwash. Her name is Linda. She's 63. She told me she'd had bad breath for about 3 months. She'd tried everything, different toothpastes, expensive mouthwashes, tongue scrapers, chewing gum all day. Nothing helped. She was starting to avoid her friends because she was so self-conscious. When I examined her mouth, everything looked reasonably healthy. A little gum inflammation, but nothing that would cause the level of bad breath she was describing. So I started asking questions. How do you feel overall? Tired, she said. Really tired. Are you eating normally? Well, she'd lost her appetite lately. Anything else different? She'd been having some stomach discomfort, kind of a vague feeling of fullness. Those vague symptoms, combined with the persistent bad breath, made me concerned. I referred her to her doctor for a thorough evaluation. They did blood work, imaging, and an endoscopy to look at her stomach. They found early stage stomach cancer. Because we caught it early, Linda was able to have surgery. She's now cancer-free 2 years later. She tells everyone that her dentist saved her life. But really, her body saved her life. It sent her a warning, she paid attention, she took action, and we were able to help. That's what I want for you. I want you to listen to your body. I want you to take bad breath seriously, not just as a social problem, but as a potential health signal. So, let's talk about what you should actually do, step by step, if you have bad breath. Step 1, improve your oral hygiene for 2 weeks and see if it helps. Brush your teeth at least twice a day for 2 full minutes each time. Use a soft bristled brush and fluoride toothpaste. Floss every single day, getting between each tooth and under the gum line. Brush your tongue or use a tongue scraper. Drink plenty of water. Avoid tobacco and limit alcohol. Step 2, if your breath doesn't improve after 2 weeks of excellent oral hygiene, see your dentist. Get a thorough examination. Be honest about your concerns. A good dentist will not just look at your teeth, but will ask about your overall health, your medications, and other symptoms. They'll check for gum disease, decay, infections, dry mouth, and other oral causes of bad breath. Step 3, if your dentist says your mouth is healthy or if treating dental issues doesn't resolve the bad breath, see your primary care doctor. Tell them about the bad breath, describe the smell if you can, tell them about any other symptoms, even if they seem unrelated. Your doctor can order appropriate tests based on your specific situation. Step 4, be patient but persistent. Finding the cause of bad breath sometimes takes detective work. It might require blood tests, imaging, referrals to specialists. Don't give up. Keep advocating for yourself until you get answers. And throughout all of this, remember that you're not being vain or silly for caring about bad breath. This is about your health. This is about your quality of life. You deserve to feel confident, in social situations. You deserve to kiss your spouse without worrying. You deserve to play with your grandchildren without holding back. And you deserve to have any underlying health issues identified and treated. Let me give you some practical tips for managing bad breath while you're figuring out the cause or after you've addressed the underlying issue. Stay hydrated. I keep saying this because it's that important. Water is your friend. Sip it all day long. Clean your mouth after meals. If you can't brush, at least rinse with water. Swish it around vigorously to dislodge food particles. Chew sugar-free gum, especially gum with xylitol. This stimulates saliva, and the xylitol actually inhibits bacteria growth. Eat fresh, crunchy foods. Apples, carrots, celery. These are nature's toothbrushes, and they help clean your mouth and stimulate saliva. Consider probiotics. Emerging research suggests that certain probiotic strains can help balance the bacterial population in your mouth and reduce bad breath. Look for products specifically formulated for oral health. Avoid mouthwashes with alcohol. They dry out your mouth and can actually make breath worse in the long run. Use alcohol-free varieties or just rinse with water. See your dentist regularly, every 6 months for most people. More often if you have gum disease or other issues. Professional cleanings remove buildup that you can't remove at home. Keep a food and symptom diary. Write down what you eat, how your breath is, and any other symptoms you notice. Patterns might emerge that help you or your healthcare providers identify triggers or causes and manage your overall health. Control your blood sugar if you have diabetes. Take your blood pressure medications. Maintain a healthy weight. Don't smoke. Limit alcohol. Exercise regularly. Manage stress. All of these things affect your oral health and your breath. You know, I've been practicing dentistry for over 25 years, and the thing that strikes me most is how interconnected everything is. You can't separate your oral health from your physical health. You can't separate your physical health from your mental and emotional well-being. It's all one system. When someone comes in with bad breath and we're able to identify and fix the problem, whether it's gum disease or a systemic condition, the transformation is remarkable. They smile more, they laugh freely, they engage with people, they feel confident again. That's not just about their breath, that's about their whole quality of life. And for those of us in the second half of life, quality of life is what matters most, isn't it? We've worked hard, we've raised families, we've built lives. Now we want to enjoy our grandchildren, travel, pursue hobbies, spend time with friends. We don't want to be held back by embarrassment or by preventable health problems. That's why I'm so passionate about this topic. Bad breath might seem like a small thing, but it's not small to the person dealing with it. And it's not small when it's a signal of something more serious. I want you to take away 3 key messages from our conversation today. First, bad breath is common, but it's not normal. If you have persistent bad breath despite good oral hygiene, there's a reason, and that reason can and should be identified. Second, bad breath is not just a social problem. It can be a window into your overall health. Pay attention to what your body is telling you. Different smells can indicate different conditions. Don't ignore the warning signs. Third, you have the power to address this. See your dentist. See your doctor. Be your own health advocate. Ask questions. Insist on thorough evaluations. Don't accept vague reassurances if you know something is wrong. Trust your instincts. Your health is precious. Your comfort and confidence matter. And you deserve healthcare providers who take your concerns seriously and work with you to find solutions. If you're watching this video, chances are you or someone you love is dealing with bad breath. I hope what I've shared today has given you valuable information, practical strategies, and most importantly, hope that this problem can be solved. I'd love to hear from you in the comments. Have you dealt with persistent bad breath? What was the cause? What helped? Your experience might be exactly what someone else needs to hear. And if you found this information helpful, please subscribe to the channel. I'm here to provide practical, evidence-based health information specifically for adults over 55. We'll talk about teeth, gums, overall health, and the connections between them. Because staying healthy and vibrant in our later years is absolutely possible when we have the right information and take the right action. Take care of yourself, listen to your body, and remember, your breath is trying to tell you something. The question is, are you listening? Thank you for spending these 20 minutes with me. Stay healthy, stay confident, and I'll see you in the next video. Asterisk, asterisk. The core message. Asterisk, asterisk. Your breath is not just about fresh mint and confidence. It's a messenger carrying information about your body's health. When you pay attention to persistent bad breath and investigate its cause, you're not being vain or overly concerned. You're practicing good preventive medicine. You're listening to your body's early warning system, and you're giving yourself the best chance to catch and treat problems while they're still manageable. In this stage of life, that awareness and action can literally add years to your life and life to your years.